The culture of neglect of workplace health and safety impacts not only healthcare workers, but also contributes to a declining quality of healthcare that they are able to provide to the communities they serve. Now, there appears to be inadequate or proactive or preventive procedures in place for identifying hazards, evaluating risks, preventing workplace injury and illness, and maintaining a safe workplace in our health facilities. Occupational exposure to blood and body fluids is a serious concern and presents a major risk for the transmission of infections such as HIV and hepatitis, especially for healthcare workers in sub-Saharan Africa, a region that accounts for the highest prevalence of HIV in the world. Now, disturbing reports coming through suggest that healthcare workers in South African hospitals are becoming more vulnerable and an easy target for physical and other forms of violence. So today we focus on healthcare worker safety. Be part of this show by calling us with your questions or views on Johannesburg 714-6843, 6847 or 6857. Or interact with us on our Facebook page, SABC Health Talk, and on Twitter at SABC Health Talk. Now, we have experts on our panel from the National Department of Health, the National Institute of Health, and the Democratic Nursing Organization of South Africa. So sit back, relax, and learn from this exciting show ahead. I'm Dr. Sello Mutaung, and this is Health Talk.
I think when looking at the kind of measures, one has to look at quite an integrated approach. There's one is, firstly, one to need to raise awareness. So healthcare workers need to be, what is the risk of exposure?
Violence, it has a psychological, emotional, impact on a person, particularly if it's verbal.
Sometimes the community is not being fair on us staff, including nurses, doctors, and all.
The nurses, it's not fair on them to be violated.
Now, healthcare workers play a crucial role in the implementation of health policy and the provision of healthcare services to all members of society. It's hardly imaginable to contemplate a society without healthcare workers. Despite the many important roles that they play, healthcare workers' rights are often overlooked as they are continuously confronted with an array of hazards in their workplace. Now, let's learn more about these hazards from our special guests. First up is Ms. Shireen Padesi, Chief Director for the Medical Bureau for Occupational Diseases, or MBOD, and the Compensation Commission for Occupational Diseases, or CCOD for short. Now, this is within the Occupational Health Cluster in the National Department of Health. Shireen Padesi, welcome to Health Talk.
Thank you very much, sir.
Right. And the next we have Ms. Maditapo Masemula, who's the Acting General Secretary at Democratic Nursing Organization of South Africa, or DINOSA, as we call it. Welcome to Health Talk.
Thank you for inviting us, and thanks to your viewers.
All right, and then in our Cape Town studio, we have Dr. Sophia Kisting, who's Executive Director for NIOH, or the National Institute for Occupational Health, previously Director of the Global International Labour Organization, or ILO, programs on HIV/AIDS and the World of Work based in Geneva. Now, Dr. Kisting was recognized as one of 10 influential women in occupational health and safety internationally by the Journal of Epidemiology and Community Health. Welcome to Health Talk, Dr. Kisting.
Thank you, Mr. Matuang, and good greetings to your listeners.
All right. Now, we couldn't have chosen a better topic or a more relevant topic. I mean, we're marking the end of Women's Month. And when you talk healthcare workers, the majority of healthcare workers in this country, and I imagine anywhere else in the world, are women. Now, let's talk a little bit about the role that healthcare workers play in society. Let's start with you, Dr. Kisting in Cape Town.
Good morning, Mr. Matuang, and to listeners. Healthcare workers play a critically important role, not just in health service delivery, but also to ensure that we provide the services that is so much needed for a healthy workforce and for a healthy citizen throughout our country. Healthcare workers on a day-to-day basis, they tend to work many long hours. If we look at our health sector, both the private and the public, we find that the majority, by far, of those who work in the healthcare sector are women.
Yeah.
And we know that our health sector is dependent very, very much. The backbone of our service is made up of nurses.
Yeah.
And so nurses are also by far in the majority women. And we have a situation where the arrangement of working time in our health services sector is such that women then tend to work 12-hour shifts. And that, of course, has an impact on family life because our public health sector, our public transport sector has challenges that adds to the long working day of the bulk of healthcare workers.
Yeah, Dr. Kisting.
Then, of course, within workplaces, healthcare workers are exposed to many, many different challenges.
Yeah.
These include biological hazards, which could be a concentration of exposure to tuberculosis. It could be a concentration of exposure to chemical hazards. It could be just the issue of being understaffed or the big load and the very heavy burden we have with regards to diseases and injuries in our country, so that you find health workers are very often overworked, both nurses, doctors, emergency services, and as well as cleaners, because
now, Doctor,
each and every worker in a hospital setting is critically important.
All right. Now, there's a notion that, you know, healthcare workers, perhaps when it comes to employment, if you look at the type of work that they do, for them it's more of a calling rather than, you know, being employed, and therefore some people feel that, you know, they shouldn't enjoy the rights that all other employees enjoy. Let's talk a little bit about the legal framework now in terms of occupational health and safety with regards nurses. Do they have rights like anybody else?
Yes, no, absolutely, they do have rights I like to usually start with our Constitution, you know, where our citizens have a right to a healthy the right to health, and certainly under the many different labor laws that's operative within our country, health workers have rights, and nurses have rights, and doctors have rights, young doctors, more senior doctors, and all the other workers within the health sector. We have the Occupational Health and Safety Act, which essentially make it incumbent on employers to provide a healthy and safe work environment. We have several, we have the Compensation Acts, and unfortunately we still have different two types of compensation systems within our country that we hope in future will be addressed and will become one equal system. But should a worker be exposed to a hazard at a workplace, then there is the opportunity for compensation. However, in the occupational health field, we are very, very, very keen not to have a compensation approach, but rather to have a preventive approach, so that we wish to organize workplaces in such a way under the different labor laws, which range from the basic conditions to employment, the Employment Equity, the Occupational Health and Safety Act, the Environmental Act, the Biological Hazardous Act, and several others.
Sure. All right, maybe let's just, at this stage, sorry to interrupt you, let's invite some comment from our guests here in Johannesburg. Let's start with you, Shirini. You know, I mean, you obviously on the other side on compensation, and Dr. Kisting quite rightly puts it that we should be more, in our approach, more preventative rather than looking at compensation. Let's talk about the workplace now, the sort of stuff that comes through to you. What does it indicate in terms of what workers are faced, particularly healthcare workers?
My understanding, let me first indicate that Dr. Kisting is very correct, that we have a legal framework in this country.
Yeah.
And the legal framework has to be implemented. There has to be close monitoring and evaluation of that legal framework to find out if the employer is indeed following the kind of prescripts of the law and creating an environment that will not result in accidental, injury, and that would actually make the workers vulnerable.
Are employers complying in that respect?
The sector that I am looking at, which is the mining sector in particular, I would think that a lot of our occupational injury is coming from the negligence in the workplace.
Well, let's hear from a nurse on the ground. Negligence. Are there hazards because of negligence on the ground?
I don't think so, especially in the health sector. And I think one will know that we have been inundated with a lot of challenges as far as our health system is concerned. I think when you talk about occupational health and safety, there are stipulations that is stipulated by the Act, Health and Safety Act, that all employers need to adhere to. And I need to say that the Department of Health in other institutions are not adhering to that. But it's also the responsibility of the employee. Within the Act, it will be stated when you look at Section 14 of the Occupational Health and Safety Act that stipulates that employee needs to always be mindful of their own safety first, and after that, the safety of their patients.
So you say generally when it comes to healthcare worker safety, the employer has a responsibility, but the employee also have responsibility.
Yes.
Let's just hold it there because we need to go for a break. Now, please stay with us because after the break, we now discuss exposure to biological agents that cause illnesses such as HIV, hepatitis, and TB, amongst others.
This is not a road, it's an invitation. This is not driving, this is carving. These aren't bad conditions, because there's no such thing. Okay, this is treacherous, but so what? This is not a mountain, this is the next level. All conditions are perfect conditions. The new Audi Q3.
Hello, it's a favorite minister here. Yane, party is a very nice language because it was written by you, the people. Here's a good one. Try hard, an individual who tries against all odds. Hoy! Give me water!
Lead the way with a bottle of Scottish Leader for $119.99 and help make party South Africa's 12th official language. Tops at Spa. Shake things up.
Health workers are exposed to blood and other body fluids in the course of their work. Therefore, they are at risk of infection with blood-borne viruses including HIV, hepatitis B and hepatitis C. The most common way in which these infections are transferred is through needle stick injuries. Some nurses regularly experience needle stick and similar injuries. We spoke to Nurse Brown to tell us why it is so that some nurses are reluctant to report these cases and to tell us about the structures that are put in place to reduce this problem.
I think sometimes they are given the wrong information and they are also told that it's not significant, although we do enforce that it doesn't matter how big or small a needle stick or an injury is, it gets reported.
She further explains how fatigue is likely to be the reason why some health workers get injured at work.
They report it to their shift leader or the unit manager, and then they will go to casualty and report it there. If they need any additional counselling in that, they will come to infection prevention and control, and they can always get hold of us because we do 24-hour call.
BT is a medical technology company that manufactures medical supplies, devices, laboratory equipment and diagnostic products. They spoke to us about safety measures to reduce needle stick injuries.
I think when looking at the kind of measures, one has to look at quite an integrated approach. Firstly, one to need to raise awareness. So healthcare workers need to be, what is the risk of exposure? Secondly, there's the issue around training. So training around good clinical practice. And that is training supported by clinical guidelines. And typically we look at the WHO guideline for safe injection practice, clearly describes what good clinical practice needs to be to reduce needle stick injuries. And then importantly, one area of focus from the WHO guidelines is the access to smart devices. So you have to have good training, but access to devices that reduces the risk of needle stick injuries.
The new WHO policy and guidelines recommends the rollout of smart syringes to be used in public healthcare facilities globally. DP has taken steps on educating health workers about the new smart syringes.
Smart devices, they've actually been on the market for an extended period of time. They fall into two categories. So one part of smart devices, actually needles and syringes are single-use devices. So there's a category of smart devices so designed to prevent reuse. They're called reuse prevention devices, so that you cannot be used on multiple patients. Importantly, one device per patient per procedure. The next set of devices, which you call reducers for safe injection practice, and these are, for example, examples of these. And these really reduce the risk of needle stick injury. So typically, this is an IV cannula, which will be used within the hospital. And when you have a needle exposure, the smart device, so simplistically, which means you now reduce the risk of a needle stick injury through the healthcare workers. This is an example of an IV cannula, which is a safety engineered device.
The health sector is responsible for the prevention, diagnosis and treatment of illnesses that are affecting society at large. During the courses of their duties, health workers are often confronted with a lot of hazards that are often associated with stigma and discrimination. Healthcare workers' safety is everyone's responsibility.
Everyone's responsibility indeed. So we're told fatigue, work overload, stress, burnout make healthcare workers more prone to these accidental injuries such as needle sticks. Now this, of course, as we heard, results in transmission of preventable diseases such as HIV and hepatitis. But is this a case of negligence on the part of the nurses, or is there something else that can be done to protect them? Well, we're going to learn more from our guests. We still have Shireen Padesi, Chief Director, MBOD, CCOD within the National Department of Health. And we have Maditapo Masemula, Acting General Secretary of DINOSA. Now, let me start with you, Shireen. In terms of, the load or the burden of HIV and some of these biological, agents that infect healthcare workers, do we have an idea of the burden? I mean, the statistics that perhaps come through to your end?
In terms of the statistics, let me first indicate to your viewers, I'm not a doctor by profession.
Right.
So I don't have the most recent stats in respect of that. That would come from a different unit within the Department of Health. In the case of occupational health, where I work, which is dealing predominantly with a very vulnerable sector like miners and ex-miners, for instance, yes, the statistics indicate very correctly, like your script is saying, it's fatigue, it's stress. And these kinds of statistics that come forward actually show that there is a burden on the healthcare worker itself. And for them to actually make sense of their work, there has to be resources and capacity building. And of course, training, to prevent. I think we must still emphasize the point that prevention is still the key.
No, absolutely. Perhaps let's cross over to Cape Town and ask Dr. Kisting, perhaps from a global perspective now, when you're looking at healthcare workers in general, do you have a sense of the load of accidental transmission of, biological agents that cause diseases such as HIV, TB, and whatever else?
Yes, certainly in our own context it's difficult to have the aggregate data, but we do know that it differs from country to country. If we just consider in the countries where there's a very heavy load of HIV, we have sort of anecdotal evidence that a big percentage of workers are at a risk on a day-to-day basis. And of course, one of the biggest worries with regards to needle stick injuries and so on is the fact that they may very well contract hepatitis, but of course there's also the possibility of seroconversion with regards to HIV, so that both the WHO and the ILO and so on have really worked very, very hard with member states to find ways to reduce the risk, and I think that is what we should look at, because so often the statistics that we have available does not truly reflect the risk. And if we have a risk-based approach in our country, for instance, where we know the burden of the prevalence of HIV and of hepatitis B, the background prevalence is high, all the more reason for us to have a risk-based approach, to assess the risk to the health of every health worker who go to work every day, that we treasure their protection, that we put policies in place to actually really make sure that both the management and the workers fully understand the risk to health, but also what are the factors to mitigate against that risk. Okay. And I think that is one of the areas where we find that different government departments are interdependent, and I truly believe, having worked at the global level, that we have the capacity and the possibility within our country to overcome the challenges that we face.
All right, let's stay on the risks.
And sometimes the challenges seem overwhelming, but it's amazing if we look at a workplace organization, how much you can enable workers to protect themselves while at the same time have excellent policy coherence to ensure that everyone knows how to reduce that burden within the public and the private sector.
Oh, okay. Now let's stay on the risk. Let's understand now. I mean, obviously we talk about an integrated approach where it's everybody's responsibility. I mean, in terms of management, when it comes to perhaps needle stick injuries, supply of those smart devices that we'll come back to. But let's just try and understand the risk factors from a nursing perspective now. What are the risks that, pose, that are, that nurses face in terms of needle stick injuries?
I think before you even go to the symptom, let's find out the cause.
Right.
I think the slot that you just played have highlighted what the problem could be, which it could be fatigue. I think research has shown that what we call compassionate fatigue can lead to a lot of problems, where you find that nurses are working in institutions where they have a high volume of patients that they need to deal with. And also burnout, because burnout can make you scientifically to not be in the state of mind that you are supposed to be, and also not to be empathetic enough with the patient that you are working with, because you are frustrated, you want to assist everybody, and it's not possible. And during that time, and especially when you look at vicarious trauma, that's where problem starts. Because, if you can't concentrate, if you're tired, if you're fatigued, you tend to have omissions and commissions that you are doing that might lead to litigations at the end of the day. But I think it becomes important that it's not even about policy, like Doctor is saying in Cape Town, but it's the application of that policy. And I think as organizations and trade unions, we need to ensure that policies are being implemented.
But are they being implemented?
I don't think so. That's my part. If they are implemented, they are not implemented fully. Because if they are implemented fully, we wouldn't be seeing the problems that we are seeing. I'll give it for an example. We have what we call the Employee Assistance Program policy that have been implemented a long time ago. And when you look at the health professionals that are working in the health sector at the present moment, especially in the public service, you'll find that people work in very traumatic departments, like when you work in trauma, and if you work with sexually abused services, people are not given the counseling that they require. People are not having a forum where they can go and be counseled in privacy without the next person knowing about it. And the
major problems.
Sometimes tend to use those for disciplinary, because in research it has shown that when employees are being referred for EAP, usually it's for disciplinary purposes.
All right. Obviously, I mean, there's a lot that we can cover around that. But anyway, let's just pause for a moment. And now, are criminals now targeting healthcare workers in our hospitals? Find out after the break. Please stay with us.
She isn't saying no to sex because she's playing hard to get.
Because she's leading you on? Because she wants you to dominate her?
She is saying no because she does not want to have sex.
Sex with the elderly that aren't strong enough to fight you off, that is rape.
Sex with a child is rape.
And the penalty for rape is severe.
And nobody,
not a friend, not a family member,
not a single member from your community,
will think that what you did was right, acceptable or tolerable.
They will be happy to see justice done.
Start listening to the words of our women.
Start respecting that no means no.
Rape is rape. Let us bring an end to it together.
Health workers are at risk of violence all over the world. In South Africa, nearly half of the nurses suffer abuse at some point in their careers. The violence ranges from harassment to assault, both verbal and physically.
Violence, it has a psychological, emotional, impact on a person, particularly if it's verbal. Whatever words the perpetrator may actually have used on the victim, you find that it can affect the victim psychologically as well as emotionally, where you find that some people actually become withdrawn, and some people they become sick, they don't come to work, or they can actually be aggressive in some instances against everybody at work. So that's why we have a system in place where we do counseling for them, and if it's actually physical, employees are made aware that they can actually even report to either labor, which is an internal body to assist them. But if they feel that it's not enough, and they can actually go and report it even to the police if it's physically, and they feel that they really want to open a case against the perpetrator.
Many more are exposed to verbal aggression, and in most cases, the perpetrators are patients or visitors.
I have personally been violated by relatives, and you find that in cases whereby they have their patient here, they want to come and see their patient at any time, and when you try to explain to them that we have visiting hours that are stipulated to say from 3 to 5, they'll say no, it's our patient, it's our family, it's our relative, we have to see them whenever we want to see them. And then even though you try to show them, okay, this is the policy that's written down, they don't understand because they want to see their relative at any time that they want to, or they feel they can see him. Sometimes the community is not being fair on us staff, including nurses, doctors and all.
I haven't been physically attacked, but we are not brought up in the same way. There are people who are very rude when they consult. There are people who are insulting and all that, but as a health professional person, you don't take that to heart or to hate. You just think, oh, okay, there must be an underlying reason for the person to behave the way he or she is behaving. So normally I don't take it personally.
Categories of health workers most at risk include nurses and other staff directly involved in patient care, emergency room staff and paramedics.
The nurses, it's not fair on them to be violated. The young doctors, any doctors, they also get it. They get their share. They get their fair share, but the nurses get it first.
Violence against health workers is unacceptable. It has not only a negative impact on the psychological or physical well-being of healthcare staff, but also affects their job motivation.
Most of the health workers, some of them, they still don't come out, to report violence in the workplace. And so we encourage them actually to speak out and to report violence in the workplace. And we still have to, as staff in the wellness, we still also have to do a lot of marketing and, make the staff aware of the programs that we have in terms of the procedures to follow when there's the workplace violence. Some of them, they still don't know what procedures to follow, who to contact. So that one also, it's a limitation on our side, but we are working on it. So I would encourage them to speak out and to come forth and to report.
All healthcare workers in South Africa devote their lives to working under all types of conditions in order to improve the lives of South Africans in need of public health care.
I feel that it's unfair for the nurses to be violated while they are working in their working place, because they are here to serve a purpose, to help the community and to help the patient. So people are coming with different ideas of a Batupile principle, to say we've got an access to come in, I've got a right to stay with my patients. These are the problems that we are having. Most of the time they just want to sit with their family inside. Just imagine if you've got one patient with 20 relatives. It's not fair for other patients and we are unable to work. That's where the problem comes and they fight a lot.
Now, any form of violence against healthcare workers cannot be acceptable in any normal society. Now, are hospitals and clinics becoming easy targets for criminals? And if so, who are these criminals? Well, let's explore this further with our guests. And perhaps let me start with you, Maritapo. We've seen in that clip that, you know, some of the people that, if for lack of a better way of putting it, that contribute to the stress, you know, against nurses are actually relatives of patients, and in some instances, patients themselves. Please give us your experience.
I think that is really happening, and sometimes I'll say it's frustration also from the public, and it has to do with the health system. And one will ask yourself is, when that happens, usually you find that there's not enough staff to can cater or take care, because if you have somebody that is sick, and you'll be worried. Remember, our hospitals in themselves it's not an environment where people want to see themselves. The only thing that you want is to see your relative being healed and going back where they belong. And it's also the cause of all this antagonistic type of relationship where somebody who's a visitor will come and say, I want to see my mom who's a patient, and the nurse will come and say, no, but you can't see her now, the doctor is still busy with her. And without you know, an issue of understanding or putting yourself in the place of that particular nurse, because usually you find that in a ward, a nurse has to look at 40 patients, and you prioritize. You say, which patient must I give first priority first? And as a patient, you think you are of first priority at the end of the day, and that's where conflict starts. And I think it has to do with allocation of staff, skill mix. It has to do with a lot of challenges that are out there, and these are health system problems that we need to deal with head on, and we need to assist each other and also assist the Department of Health to come up with solutions how we can assist, because we promised as a country in our constitution, in Chapter 2 of the Bill of Rights, when you talk about the rights of citizens of this country, they have the right to health. And if they have the right to health, you must provide them with that resources, and those resources is also human resources that can do the work.
So essentially you're saying, I mean, there's frustrations on both ends. On the patient side and their families is the whole question of, you know, for instance, long waiting hours and what have you before people get seen. On the other side is people that are being overworked, that are supposed to look after these people that are agitated already.
Yes, but I think the other thing that also we need to maybe educate the community about is that when you talk about nurses, we are talking about different categories. You see, what we see and the research that we have done as DINOSA, especially when there are incidences, especially at clinics, is that communities will come and say, a nurse was seated and she just took my temperature and after that she left me. And when you investigate, you find that that was an assistant nurse. And people need to understand that we have 3 categories of nurses in South Africa. I'm not going to talk about specialties. And they have specific roles that they are supposed to play. And an enrolled assistant nurse will only do basic elementary treatment, and a staff nurse will do basic nursing. And a registered nurse is the person that is having the capability to can evaluate, assess, and treat. And the others are just assisting the registered nurse. And in most cases, you find that in clinics, some clinics are not well equipped with these human resources that I'm talking about, or this category of nurses that I'm talking about.
Maybe let me invite a comment from Shirini. Shirini, clearly there's lots of psychosocial stresses that are facing nurses, and this can easily trigger development of mental illness. Now, do we have an idea of the burden of mental illness in the healthcare worker sector?
From the side of the Department of Health, we have a special unit that's dealing with mental health and all of the psychological issues that accompany all citizens, let's not just say health workers. But I think in the first instance we must understand that nurses and all healthcare workers as well as patients are human beings. And as human beings they are responding to different issues in different ways based on the circumstances. I think what the South African public needs to understand and appreciate is to give the healthcare workers the space in which to do their work. Currently, we understand that you have a patient, you have a parent or a child or a sibling who's in need of healthcare. But if we do not allow that space, how will the healthcare worker be able to deal with that? These kinds of frustrations then lead to either accidental or intentional criminal acts, in an attempt maybe to, vent their frustration, or in another way to express what they want. So the South African public in general must learn to respect the workplace of the healthcare worker and give them the space in which to operate.
Difficult as it might be.
Absolutely.
All right. Let's cross over to Cape Town and perhaps get a comment from Dr. Kisting in terms of the burden of mental illness within the healthcare worker sector.
Yeah. The burden of mental illness amongst healthcare workers, once again, is by and large unmeasured because it's totally underreported. I do not think we organize our workplaces in such a way to make it possible for nurses and young doctors and for cleaners and laundry workers and so on to readily report the kind of psychological stresses that they are under on a day-to-day basis. And so, once again, we know that the risk is huge. Because if we look at just the issue of violence, I mean, it's not just physical violence that healthcare workers are exposed to. It's also the psychological violence, the issues that we are working in a system that is very hierarchical. And so we find that some of the junior nurses, the junior doctors, and so on, are at the bottom end and sometimes also exposed to issues ranging from direct verbal abuse to actual sexual harassment and so on. And I think because as a society, for a number of reasons, which may be related partly to economic inequality and some of the problems, the legacy of our past, many of those problems are still reflected in violence within our society, and that violence is carried into the healthcare worker workplace. And I think healthcare workers are expected, by and large, as you said initially, to sort of have the Florence Nightingale approach. It's a calling. But I think the situation has really at times reached breaking point. And so I think it's incumbent on us, and I think the media can play a very, very big role, where we start to interact both with the broader civil society to understand the role of health workplaces, but also what are the challenges, so that we are not pitched the health worker against the community who is very, very worried about a sick relative, but that we reach an understanding, that we find a way that we need to interact, and how communities can also support their health workplaces to be better. We in our constitution, or rather right in the beginning, in the 1990s, we try to find ways to say, let there be health committees interacting with clinics and with hospitals.
Just hold it there, because I'd like us to focus on solutions in our next segment. For now, we just need to go for a quick commercial break, and when we come back, we answer the question, just how can we improve health and safety in general for our healthcare workers in South Africa and anywhere else, of course.
What is beauty? Is it a view that's been waiting for you for centuries? A setting that gives you goosebumps when you see it for the first time? Is it a moment that stops you in your tracks and leaves you in awe? Some people spend their whole lives looking for it. When you open yourself up to it, suddenly you find yourself in a place where true beauty isn't something you'll ever see. Because when you meet South Africa, you'll reconsider what you think you know.
Welcome back to Health Talk. Now we're talking healthcare worker safety. Now we want to answer the question: just what can we do to improve health and safety of our healthcare workers, and whose responsibility is it? So let's get some enlightenment from our guests. Shireen Padesi, Chief Director, MBOD, CCOD, Maditapo Masemola, Acting General Secretary of DENOSA. Perhaps let's start at government level now. What is the role of government insofar as improving, well, I suppose maintain, first of all, healthcare worker safety and of course, improving the current situation?
At the beginning of the show, we spoke about the legal framework,
right,
the policies, the question of educating our public around these things. So from the side of government and rendering the service, it's about policy implementation. It's about policy development. It's about capacity building. It's about proper signage in facilities. It's about regular updates to the public, talking to them, ensuring that a simple example would be, if you're getting frustration in the amongst patients, what about doing something different in the patient waiting area, rather than just letting them sit there and become frustrated? So from the side of government, it's important for us to ensure that healthcare workers are protected, and that in their sense that their rights and responsibilities are respected as well, and that the policy implementation process is properly monitored and evaluated on a day-to-day basis, not just left after a few months or a few years, so that things just become irrelevant after a while.
That's where the problem is, isn't that so? It's easy to write policies and, have them quite nicely, filed and so on. But the implementation and the monitoring, that's where the problem is. What can be done, at that level?
I would think in the first instance, as we develop this country's healthcare system, the issue of partnerships, the issue of collaboration and cooperation, even with the unions, it's important. And we're doing that currently, speaking to them, the kind of cooperation that's coming from them and other unions that are involved in healthcare work, stakeholders, relevant people who can go out and make this a united effort. And that's what government is striving to do, is to ensure that there is a buy-in from all stakeholders in terms of the implementation of policy on a long-term basis.
All right. Before we get to the unions, let's invite comment from Dr. Kisting in Cape Town. Dr. Kisting, the role of government and perhaps, other international bodies such as WHO, ILO, and so on.
Yeah. No, thank you very much. There is a saying amongst us health workers where we say, who care for the carers? And I think in our country we very much wish to have a much more caring society. And one of the first things I think we need to look at are the conditions of work of health workers, the issues of equity within that, the issue of income equity, and I think government can do a lot with regards to that. And then we need the introduction of new knowledge all the time. What is the new knowledge that can improve work relationship between management and workers? I come from a work environment where I absolutely believed in the concept of decent work. We have to improve the conditions of work. And a lot of that has got to do with communication at workplaces and the issue of social dialogue. Shireen mentioned trade unions. They are fundamental to making us a strong and very civil society.
All right.
So their role, focusing on workplace conditions and so on, get those improved. Then the policies you refer to, it's critically important that we need to implement them. But once again, line management, CEOs, workers themselves, everyone must understand what the policies are and work on those.
All right, Dr. Christie, let's just take a caller on the line, Soli from Port Elizabeth. Soli, welcome to Health Talk.
Good morning to you and your panel. Actually, I'm calling from Butterworth.
Butterworth, my apologies. Yeah.
Okay. Firstly, thank you very much for this informative program. I usually watch it and I like it.
Thank you.
And I am a member of the community health around our area.
Yeah.
Space to work for nurses. There is space. We as a health committee member, we make sure there is space to work for the nurses. That we try to make the people to understand that they must give these nurses space to work. But then if they must be given space to work, what do you do when you don't have enough staff so that these people can work as quick as possible? The government has recently pronounced about Pakistan. They say that patients, they must not wait for longer than 2 hours at a clinic. I stand to be corrected because I see you have a member from the national department. Now, these pronouncements are made on public media and stuff like that. And people, they hear about this issues.
All right. Okay.
And when they come to the clinic, they expect that standard to be there.
All right.
Now, how
thank you very much, Soli, because we have very limited time, but thank you very much. I think your points are well made. Let's put it to the National Department of Health. Soli says that, we make these pronouncements and, the public expects that these things happen that they hear about in hospitals. Are they happening?
I would think yes and no. And let me start with the yes part. It's the vision of the Department of Health to ensure that you've got proper management at all facilities. And we've seen some remarkable examples in the facilities that we have that have actually shown some very good turnaround results. But we are trying to build a healthcare system in this country. So we're going to have problems as well. So in the instance of what Soli is saying, I appreciate that. It's an issue that we would look at as government, but it's a question of where is the management to deal with that problem. Of course, there's human resource shortages, but what are the creative means we can all get to in order not to frustrate the patients that come to our facilities?
All right. Maritab, from the nurses now, I mean, we've heard about government's responsibility. From the nurses' perspective, what's the way forward?
I think, you see, the issue of safety in the workplace, it's a human issue, and for nurses, it's about their livelihood and all healthcare workers. And when you go to work, you need to feel you are going there to give your best in a very safe and secure environment, free from any type of hazard that one can be thinking of. And then the way forward will be us as organizations and trade unions to work together with the Department of Health, ensure that policies that are there are being implemented and to the fullest. And where policies are not implemented, find out a cordial relationship where we can talk about it so that we can come up with resolutions that can benefit all at the end of the day. Because remember, this is not a problem that can be solved in one day, but it's a problem that it's issues that can be achieved if there's proper, if you have progressive people out there that are willing to can listen, to can hear to different opinions, irrespective of where the opinions are coming from.
All right.
But the leadership that we have is leadership that sometimes, like Shireen has said, they are not willing to listen. They'll paint to...
Okay, so So it's management and, of course, everybody working together. Unfortunately, we've run out of time, and I wish we could have a little more time, but that's how much we have. And I'd like to just take this opportunity to say thank you very much to Dr. Kisting in our studio in Cape Town, and of course in our Johannesburg studio, Shirin Padesi and Manitapo Masembula. Thank you so much for your contribution, and this is a very difficult subject, but at least I think we made our points quite clear, and hopefully our nurses and healthcare workers in general will have a better, brighter and safer future ahead. Okay, folks, it's on that note that we're going to come to the end of our show today. Now, as a reminder, please share your views and comments via Facebook, SABC Health Talk, and follow us on Twitter at SABC Health Talk. So join us again next week on SABC News, and you can watch repeat of our shows today, 2 p.m. and 10 p.m. And of course, get all the other previous shows on the YouTube link. I'm Dr. Silo Mcdowell. Thank you so much for watching Health Talk, and please do take care.